Hello, this is Professor Yamini Bhushan Tripathi. I am PhD in biochemistry and I have been the Dean Faculty of Ayurveda in Banaras Hindu University. And I am participating in a program for the SWAM portal, which is being coordinated by Professor Shues Tripathi, Associate Professor, Department of Cardiology. And today I am going to talk about aging and palliative care. You know, most of the time, the patients who are having the chronic diseases, they are old people. This is not necessary, but most of the time, the palliative care is required in old people suffering from chronic diseases. This is very important to know. So, the mainstream physician treats the disease. Suppose a patient of cancer is there, the cancer is being treated by an oncologist, by a cancer physician, but because of the old age, his quality of life is deteriorating, and nobody is taking care of that. So the geriatric part has to be taken care along with the cancer treatment. So mainstream treatment by the physician, treating physician, and the other symptoms management, including aging or the age-related complications, has to be targeted. And this can be done in the palliative care. That's why I have chosen a topic, the palliative care and aging. What is palliative care? Palliative care focuses on keeping people as comfortable as possible without prolonging or reducing life. Because life span is dependent on the main disease which is being treated by the physician. But as long as he is living, he should be comfortable. The best possible life should be given to him. So we are not concerned with the disease, we are concerned with the overall mind-body relation and quality of life. The doctor may allow someone approaching death by stopping medication that is having several unpleasant side effects. We know that suppose the pain is there, and for the pain control you are increasing the dose, pain management, morphine, you are increasing. Even then it is not being treated. So you can stop it because you know that the effect is not coming. So what is the point in giving that medicine? It is unnecessarily deteriorating the quality of life. And you know that the patient is going to die in a few days. Then you can take this kind of decision. If it is a long span before death, you are giving palliative care, then you cannot do it. But it is in the end age, suppose 5-10 days are there, then you can take a decision of stopping the medicine. Higher doses for the pain management. This is often a standard part of the good palliative care. This is not unethical. This is good part of palliative care. The palliative care has also been considered to be the part of right to health care by the policy. So it means every person who is sick is supposed to have palliative care, and there should be management for taking care. It may be a financial burden, it may be some other kind of burden on the family, but he has a right. The government should take care. They should, in the insurance or in the anything, this is a state responsibility. Health is a state responsibility. Then the state should provide palliative care. And it is just that the goal of treatment becomes comfort rather than cure. Our objective is to give the comfort rather than cure. Increase the health expenditure by the government as percentage of GDP. In India it is existing 1.5, but we want to increase it 2.5% of GDP under National Health Program 2017. We have declared it by 2025 we will increase the expenditure on healthcare from 1.5% to 2.5%. And states like Kerala, Maharashtra and Karnataka have their own dedicated state policies of palliative care. This is very interesting. I think all the states of India should do it, but they are the states, they are a bit forward than other states. Now, when we talk of palliative care and the holistic approach, not only conventional medicine, but AYUSH medicine also. AYUSH is another branch of healthcare system in India. So the Ayurveda is one of them. They say there are three basic pillars: diet, sleep, and lifestyle. All the three things has to be managed for giving a good quality of life, for maintaining the wellness of a person. So this can also be applied to a chronically ill patients, and depending on his constitution, the term personalized medication. It varies from man to man. And another important thing, diet, sleep, and lifestyle, they are the personal issues. What you like, other man may not like it. So you have to talk to the person. And the earlier lectures we have already discussed the way of communication. A palliative caregiver should be very patient listener, number one. And then he should analyze liking and disliking of the patient. And depending on that, these three things should be managed. If he is not liking what you are recommending and what is good for his health, even when he is not liking, you should not give it, because you are working on the comfort zone of the patient, not on the treatment part. So comfort means likeness. You have to create a likeness, or you have to choose those things which he likes and which is also good for his health. Both things should be taken together. Then it will be good for him. Another important thing when we are talking of comfort, these sense organs, there are 5 sense organs, they are connected with your hypothalamus. And this is connected with your pituitary gland, and pituitary gland controls all your hormones, different endocrine glands. That's why pituitary is called the master endocrine gland. And the endocrine glands control your physiology. And physiology is linked to your comfort. You understand what I want to emphasize? So the satisfaction of the sense organs is very important. Satisfaction of the sense organs. How it can be given? The palliative caregiver, he has to give patient listening for few days, few hours, and then he will analyze liking and disliking, and depending on that, he will choose it. So this slide is very important in palliative care. The sense organs, if the disease has come because of this. Physiology is controlled by brain and gut also. What you eat, your mind and gut has interaction, and mind has an interaction with your sense organs. So brain is controlled by your sense organ and your gut. So both things has to be managed. The sense organs and diet is very important. Another important thing I want to say that Ashtanga Ayurveda, there are 8 branches of Ayurveda. As we have Ashtanga Yoga, similarly you have Ashtanga Ayurveda. So negative emotional states get developed in a patient suffering from chronic diseases. So these emotional states has to be taken care very carefully. How you will do it? Psychological counseling, spiritual healing, likeness and likeness analysis. These are the tools which can be given to the patient for his comfort zone. Patient should be in the comfort zone. So you have to analyze it and then you have to give. So psychological counseling is very important. And some people are very spiritual, some people may not be spiritual. So spiritual healing cannot be given to everybody, but a man who is liking, who has a spiritual inbuilt feeling, for them spiritual healing is very important. Otherwise, psychological counseling is the mainstream, main tool for convincing. And the mind-body relation is important. Once mind is cool, in tranquility, in the balanced state, your physiology will also be controlled. As I have told you in the previous slide, mind-body relation is important. And then Another important thing, hunger and appetite. Most of the time, these old people in the old age, there is a loss of appetite. The loss of appetite is a result to the nutritional deficiencies, and nutritional deficiencies escalates the chronic diseases also, and it is not helpful. Nutritional deficiency may not be helpful in treating the main disease also. So in that case, the holistic approach is very important, and in that case, what Ayurveda says that the appetite and hunger are dependent on the digestive power of the person. This is called Agni. There are 13 types of Agnis. One is the Jatra Agni, and then there are 12 other Agnis. As I told you, in the endocrine system, main master gland is the pituitary, and then other endocrine glands. Similarly, in the Agni, Jatra Agni is the master Agni, and other 12 Agnis are controlled by the master Agni. So we are talking the place of Jatra Agni, digestive power, is in the intestine, and this is connected with the liver, pancreas, and the gut microbiome. All the three things should be balanced. How it will be balanced? By your psychological and your diet and your sleep. As I showed you in the earlier slide, three are the basic pillars. So everywhere three things has to be regulated. Then only whole physiology will be under control. So psychosomatic mind-body relation I am going to talk. The perverted, negative and excessive use of time, intelligence and sense objects is the threefold cause of both psychic and somatic disorders. And he has suffered for a long time with these things. And now we want to control these issues so that he can improve. But it is very hard because the habit dies hard, very hard, very difficult. If you have developed the habit of wrong thing the whole life, slowly you have to modify. Psychological modification is required. And another important issue with the aging, the Agni has come down, your all anabolic process has been declined. So this has to be revived. This has to be revived. How it will be revived? There are the three pillars I told you, there has to be taken care. But besides that, in the lifestyle, I'm just explaining in more detail how you will treat your patients for better health, for better comfort. So try to synchronize his lifestyle with the daily rhythm. Daily rhythm means sunrise to sunset. The time of getting up, time of breakfast, time of lunch, dinner, time of listening music. Because pain is the main symptom. Other discomforts are also there. Insomnia may be there. In the aging process, in the people, insomnia is very common. So you have to manage all these things. To try to adjust the patient habits with the circadian rhythm. He will be very quickly get healed, number one, and his comfort zone also will increase. So what is the rhythm? Solar rhythm means sunrise to sunset, seasonal rhythm. Depending on the season, there is a change in physiology. And because of that, there should be change in the diet, lifestyle also. And then there is the doshic rhythm, the Vata, Pitta and Kapha I told you. I will tell you in the next slide. There is a cycle. So the 4-hour Vata will be high, followed by Pitta will be high, followed by Kapha will be high. This cycle, the day cycle and night cycle. Vata 4 hour, Pitta 4 hour, Kapha 4 hours. So 4, 4, 8, 12. 12 day time, 12 night time. So this cycle, they call the doshic rhythm. So you have to take food as per doshic rhythm, you have to sleep as per doshic rhythm, you have to do all your physical activity and mental activity as per doshic rhythm, as per seasonal rhythm, as per solar rhythm, and life cycle, depending on your age. Suppose you are giving a palliative care to a man of 50 years with a chronic untreatable disease, or you are treating a man of 70 years with same kind of disease. So depending on the age, the preference of diet, lifestyle and food will change. And the dietary, time of feeding, how much you are eating and what you are eating and when you are eating, All the three things have been given in Ayurveda. And this is very important in the aging and palliative care. Last thing is a compatible diet. Something is compatible to one person, may not be compatible to other person. And something will be compatible in one time, in one season, may not be compatible to other season or other time. So this is the compatibility. It is very nicely described in Ayurveda, and the dietitians should know it. I think unfortunately the modern dietitian, the nursing classes, it is not taught, but in Ayurveda, dietetics, it is well defined. So Kala Bhojanam, the Kala Bhojanam is time of eating, method of eating, and compositions, everything, and compatibility, these things. And here I want to tell the use of rejuvenating food supplements. This is Rasayan. I will come to the next slide. And periodical body purification, like the intermittent fasting, Langhanam. You see in Ayurveda it is called Langhanam, intermittent fasting, and Panchkarma therapy, forcefully removing the toxins from your body, and following the circadian rhythm for food and lifestyle, as these are the circadian rhythms, and control of the emotions, yoga. There are 8 branches of yoga: Yam and Niyam, Asan Pranayam, and Pratyahar, Dharan, Dhyan, Samadhi. There are 8 branches of yoga. So emotion control by yoga. And these last comes the treatment of disease. This is not the part of palliative care, but these things are the part of palliative care. This is the part of the main treating physician. We are not going to talk about this, but we are going to talk about control of emotions, control of lifestyle, body purification, and food supplements. 4 things we are going to talk in case of palliative care. Okay? Now, food supplements, supportive medicine, Rasayan and Vajikaran. It is defined. There are 8 branches of Ayurveda. There are the Rasayan is one branch, complete one branch, which deals with the premature aging. Vajikaran also deals with the premature aging. And so, what is Rasayan? Rasayan means a special branch of medicine in Ayurveda which have classification, 3 types of classification: classification 1, classification 2, and classification 3. One says nutrition, Ajarsic Rasayan, Kamya Rasayan, and Naimittik Rasayan. Means Ajarsic Rasayan is nutritional support, and this is Kamya is vitality and longevity. Those medicine, lifestyle and food supplements which are used to increase vitality and longevity are called Kamya Rasayan. And those Rasayan which are used as a nutrition, that is called Ajarsic Rasayan. And this is for disease treatment. I mean, the disease can also be treated by using the Rasayanas. So this is one classification. Other is the medicine, drug, nutrition, and lifestyle. Aushadhi, Ajarsic, the same Ajarsic here, and the Achar Vihar, Ahar Vihar, your lifestyle, Ahar Vihar. Okay? Achar Vihar. And last is the indoor and outdoor. Most of the time, outdoor Rasayan is recommended because in the old age or the chronically ill patients, he cannot go to the indoor Rasayan. They call the Kuti Praveshika. Kuti Praveshika, this is an indoor patient. It is not possible. So only Vata Pika, outdoor treatment of Rasayan is possible and is recommended for chronically ill and old age patients. This is very important slide, Rasayan for different age, as I told you, it varies from age also. So from different age, this is for a normal man, not a patient of palliative care, but I want to tell you, the class, that a person has 100 years of lifespan, and every 10 years there will be compromise of one physiology. So one has to, if it is happening before time, it is called the premature aging. And for that, the Rasayan and different age group has been recommended by Ayurveda. So I have taken this slide from Ashtanga Hriday. There are 3 major textbooks of Ayurveda, Charak, Shushruta, and Vagbhat. Vagbhat means Ashtanga Hriday and Ashtanga Sangra. For example, in the age of 41 to 50, there will be skin wrinkles. in the age of 51 to 60, there will be eye problem, eye weakness. Then there will be reproductive self organ problem in 61 to 70. It will be reduced. So for every 10 years, they have given a set of medicinal plants in the name of rasayanas. So if you are using these things, you can prevent the premature aging of that age group. Okay, this is very important slide. This is for the healthy people, for the wellness. But in case of palliative care, if you are having one of these issues with the main disease, then we can apply these rasayan even in case of palliative care. Now, in the modern medicine, the use of antioxidant supplements, resveratrol, metformin, acarbose, aspirin, rapamycin, calorie restriction, and body connection. These are the things which are successfully used as anti-aging and also for premature aging in case of chronic disease. In the modern medicine, in Ayurveda, rasayana. In Ayurveda, I have told you, these kind of rasayanas can be used, but in modern medicine, this is not there, and these recommendations are there: antioxidant, anti-inflammatory, calorie restrictions, mind-body connections. So excess use of 5 sense organs. Okay. Now I told you on the earlier side, incompatible diet. So there are 18 conditions when your food become incompatible. What are these things? The place, the time of eating, digestive power of that person, the quantity which you are eating, and the samata, whether this food is suitable for a person or not, and then tridosh, vata, pitta and kapha, what is your state, what is the genetic constitution, and what is the disease condition of that vata, pitta and kapha, dosha, and depending on that, the food is chosen for that. Then process, how the food has been cooked, and the potency, what are the things which have been added to it, and how your digestive power of the patient, that has to be taken. And what is the health status? In the palliative care, the patient is already in the chronic disease, he is suffering. And then all the things will vary. Depending on his health, you have to choose compatibility of the diet. Sequence of eating, sweet, salt, sour, what should be eaten first, what should be eaten after that. There is a sequence. If you are maintaining the sequence, the same food will be good for your health. If you are not maintaining that sequence, food may be harmful to you. That is called incompatibility. Harmful means incompatibility. Compatible means good for your health. And contraindications. What is contraindicated in the main disease? Suppose you are suffering from cancer, or you are suffering from heart disease or a stroke. Something is recommended, something is not recommended. So depending on that, you have to choose the food. These are the treatment 8 conditions which make the food compatible or incompatible for a person. So you have to keep in mind when you are thinking to change his diet to improve his nutritional status. Okay, this is the slide I told in the beginning. The vata, pitta, and kapha. From 2 a.m. to 6 a.m. the vata is high in the morning. This is the daytime. This is the night time. And from 6 a.m. to 10 a.m. kapha is high. From 10 a.m. to 2 p.m. pitta is high. This is the daytime. What I am to say, what you should do, if it is possible, then you should do the counseling of the patient to follow these rhythms. This is the vata, tridosh rhythm. So in vata time, he should have he should get up, he should have the daily routine of bowel, and then massage, then some exercise if possible. If like yogic exercises, even on the bed you can do some exercises. Not necessarily that you can go for a morning walk, but if for a palliative care and you are not able to move, but at least you are moving your hand and feet, you should keep on doing it. And the palliative care giver should help in doing these kind of exercises even on the bed, because the inactivity precipitates the disease symptoms. It is very bad. Psychologically, you are under depression, and physically you are inactive. Both things are not good for neither for the prognosis of the disease nor for the quality of the patient. So both things has to be taken care. But what time you should do? This, suppose you want to do exercise, what time? Time is this, from 6 to. You cannot do exercise any time. You cannot eat any time. Depending on the cycle, Vata, Pitta and Kapha, you should choose. For example, the eating time is from 10 a.m. to 2 p.m. because this is the best time for digestion. So the midday food should be very healthy and main food should be there that you can do. Similarly, exercise I told you, and the exercise time from 6 a.m. to 10 a.m. This is the best time for yoga, for pranayam, and for your light breakfast. If you can skip breakfast, this is very good because this is the best time for eating. But if you cannot, because of your lifestyle, because of your hunger, then you should take from 6 a.m. This is the cycle. And you see, as I told you, the night from 2 p.m., from 10 p.m. to 2 a.m., you should not eat anything. You should sleep. You should sleep. Anyway, insomnia patients don't get sleep also, and they are awakened. When they are awakened, they always have some problem. So you have to take care. You have to manage the patient's lifestyle like this. And then palliative care in aging. Chronological aging, I told you, this and the premature aging. Premature aging is an accelerated manifestation of aging signs. Factors such as lifestyle, environmental exposure like UV light, radiation and pollution, and stress as well as the certain medical conditions can accelerate aging. For example, a person is chronically ill, he is having cancer, or heart disease, or diabetes, or metabolic syndrome, then premature aging symptoms may appear to him automatically. It is a natural process because his nutrition has been compromised. The whole metabolism has been compromised. The premature aging symptoms may appear. And if he is not having, then chronological aging for 100 years lifespan is there. So this refers to the natural time-dependent aging. It involves predictable physiological changes, and this process is largely influenced by the genetic constitution. Genetic constitution predicts the chronological aging. And the body biological clock and certain milestones observed universally as people age. It is a common thing. Everybody will age, and with the age there will be some change in their physiology, and that change will be manifested as the symptom of aging. Example, decline in the bone density, decline in the muscle mass, slower cell regeneration. These are the common things which is found with the aging. So one has to be careful. But if this is happening in the premature stage, then it is a question of worry. We have to take care of it. So what are the key biological biomarkers which we can test in the aging? This is some scientific term: telomere length, DNA methylation, this is the epigenetic clock, inflammatory markers like the chronic low-grade inflammation, often called inflammation increasing with age, markers like the C-reactive proteins, IL interleukin 6, these go very high with age also, and cellular senescence, accumulation of the senescence, non-dividing cells identifiable by markers like P16 INK4A is a hallmark of aging. As a mitochondrial function and oxidative stress, this is very important. That's why we say with aging, oxidative stress is there. So use of antioxidant, as I have shown you in the earlier slide, use of rasayan or the vitamin E, vitamin A, these things are given, antioxidants. The antioxidants are very important because the mitochondrial dysfunction takes place with aging. And metabolic and proteomic profile will also let you know whether you are premature aging or you are normal aging. So these are the parameters which predict the condition of aging of a person. And in palliative care, if you are an old age person and suffering from a chronic disease, these symptoms will be higher than a normal person. You have to be very careful while analyzing these tests and then deciding the line of treatment. And the key physiological markers of the aging: cardiovascular health, respiratory function, muscle mass strength, bone density, cognitive function, and metabolic health. There are 6 markers which will predict your stage of aging. You know, in modern medicine, there is a different department called geriatrics. Geriatrics deal with the aging, but in the palliative care, geriatric and palliative care overlaps because symptoms are overlapping. A patient is in the old age but suffering from a chronic disease and having symptoms which is affecting his quality of life. That's why I've chosen this topic, aging and palliative care. They are overlapping with each other. So ICMR has put a guideline to assess the geriatric health, cover physical, cognitive, and psychological aspect. Category physical health is a weight and height measurement, BMI we call, blood pressure, get up and go test, get and balance, functional abilities, dressing and bathing, etc., fall history. These are the physical health. And cognitive health is a mini mental state examination, MMSE, Montreal Cognitive Assessment, MOCA, Geriatric Depression Scale, GDS, for mood and depression screening, Mini Nutritional Assessment, MNA. These are the proforma which are available on the internet, and these are applied to patient to understand his cognitive and mental health. Okay? And nutritional and sensory health, sensory check, hearing and vision, observation of weight loss and appetite, and monitoring of non-communicable. Okay, these 2 things are given in the nutritional and sensory health. As I told you earlier, the 5 sense organs should be properly active, and the tests can be done with hearing capacity, vision capacity, and weight loss. All these things should be monitored. And if it is below the normal limit, this is a matter of concern, and we should take care of it. And the chronic disease management is like cardiovascular disease, medication review, and polypharmacy. How much medicine a person is taking per day, that will determine the geriatric health of a person. And what kind of metabolic disease he is having, that will determine the aging of the person. So they are the ICMR guideline. ICMR, you know that Indian Council of Medical Research is a government organization of Government of India, which takes care of deciding the policy of health management. The premature aging and palliative care, a cause or an effect of NCD, a cycle relationship. This is a vicious cycle, whether first premature aging comes or a chronic, non-communicable chronic disease comes. Early biological changes like oxidative stress, inflammation, and cellular senescence is the premature aging. And this will lead to the non-communicable disease. And when the person is suffering from non-communicable disease, already he is saying the chronic disease and stress accelerates aging. The NCD accelerates aging via inflammation and impaired repair mechanism. So, whether premature aging will lead to non-communicable disease or non-communicable disease will lead to the premature aging. Which comes first, nobody knows. But anytime you have to break this cycle. That's why I am saying the in palliative care, premature, the aging factor should also be considered. You see the example, diabetes come first, and then oxidative damage, then metabolic syndrome and tissue breakdown. You see, first disease has come, then aging process has come. This is the relation. Now, list of the NCDs linked to the aging: cardiovascular diseases, type 2 diabetes, osteoporosis, respiratory diseases, neurodegenerative diseases, cancer, chronic kidney diseases, sarcopenia, muscle loss, and vision and hearing loss and hypertension. These are the diseases which are considered as the non-communicable diseases, and they are linked with the aging. As I told you in the earlier slide, whether this comes first and then aging starts rapidly, or aging comes first, means chronological aging, and then NCD appears. So this is a condition. Aging is a condition which invites non-communicable diseases. They have to be taken care of. So, role of yoga and exercise in geriatric palliative care. You know, the exercise, as I told you, the aerobic exercises are there, and different kind of trainers are there. But yoga is a comfortable way of exercise. There is a very big difference in yogic exercises and gym-based exercises. Yoga improves the parasympathetic nervous system, and this exercise activates the sympathetic nervous system. That's why we say that it is in the comfort zone. For the palliative care patient, yogic exercises are the best. We should focus on this part. So the primary benefits: improves the flexibility, balances, and mental well-being. Impact on pain, because pain management is the main in palliative care. It reduces the chronic pain through gentle movement and breakthrough and breath work, pranayama, breath work and pranayama. Stress and anxiety, reduces stress, anxiety and depression, which is very common in patient suffering, needs palliative care, through meditation and relaxation. So these are the things we should take care. Cognitive health enhances memory, focus, and reduces the cognitive decline risk. And cardiovascular health, this pranayama regulates the blood pressure, improves circulation. Pranayama is a breathing exercise, enhances lung function. Risk of injury, low impact. Yoga is a comfortable way of exercise, so low impact on the risk of injury. Safe for fragile or for elderly individuals. Mobility and independence, help in maintaining the mobility and reduces the fall risk. And end of life care, palliative care, enhances comfort, promotes emotional peace. These are the things which one should consider by giving yogic exercises to your patient of palliative care. Now, difference in the type of exercise and their impact. I'm not going to detail, you can read it. The endurance training, this is not applicable in the palliative care, but for the normal people I have told you, this is a thing. Now, intervention targeted to reduce the chronic systemic inflammation. This is the main thing, that the systemic inflammation has to be reduced in the non-communicable disease and aging. So, lowering the free radical induced oxidative damage, replacement and regeneration of the damaged tissue, and reversal of the harmful epigenetic changes, and enhancing the telomerase activity. These are the things which we should do for enhancing the quality of life, for improving the quality of life. Another important thing, because the patient is already compromised, he is not having physical activity. In that case, oleation, snehan, the body massage, oil, internal and external use. Internal also may not be allowed because he is not able to eat. But if the palliation has been started in the early stage, the chronic disease is there, but still he has the 4 or 5 years of life, then the internal oleation and external oleation both is applicable. Otherwise, in the very late stage of the disease, only external oleation, massage is very comfortable by using sesame oil or coconut oil, mustard oil, or these are the anti-inflammatory oils, Mahanarayana oil, Dhanvantari oil. These things can be used for the massage, and this is very helpful in improving the comfort and the disease stage of that patient. And then there is steam bath, Swedan, steam bath. If he is able to move the patient, then the steam bath, and in the naturopathy there is a technique called Kapla Lapet. So he should be, depending on this condition, what stage he is there. Suppose he has the 1 year of the lifespan in his disease, end stage disease, then these things are very good for him. So particularly for the Vata and Kapha imbalance, so Swedan is very important. So Swedan would be better when Vata dosha is activated. And in aging, the Vata is already very high. So we have to take care. Factors affecting the healthy aging according to Ayurveda, Kal Parinam, as I told you, the season, the time is very important. The Prakriti, the genetic constitution of the person, and the three cycle, Vata, Pitta, Kapha cycle, and subtle doshas, the Agni, as I told you, Ahar, the food, Rasayana, as I told you, are the food supplements, very important. And then behavior, when you are getting up, when you are eating, when you are taking bath, these things are important. And the digestive power. All these three things has to be taken care, which affect the healthy aging according to Ayurveda. Now, this is the last slide. So I am summarizing it, and that when you are giving palliative care to a chronically ill patient, but with old age, then along with the symptom management, you should also take care of his nutritional state. If you are taking care of his nutritional nourishment is better, then his quality of life will automatically improve. And when I talk about quality of life, then you should always think of psychosomatic. Psychological quality means your mind and body. Both should be in the tranquility and a balanced state. And this should be the objective of a palliative caregiver. Thank you very much for your patient listening.